Good afternoon, friends. I'm Dr. Rita Savda from Radhi Disaster Education Foundation. Today we've got a specific topic to discuss with you was how to give way to an emergency vehicle, that is move left and drive slow. As you'll be aware, why we want to talk this topic today, because out of 10 patients who are in ambulance, 2 die on the way because ambulance gets stuck up in the traffic. And not only they die, but sometimes their condition also become worsens, and during the building collapse or fire, if there is emergency vehicle or fire brigade vehicle, if gets stuck, also causes big impact in the survival of patient who are stuck and in the rescue work. If I talk about the health problem, the 4 major cause of death is heart attack, suicide, accident and stroke, which comes suddenly. And this are the time we call ambulance, and we need to reach the patient in golden hour to the hospital. Every day in India, 24,012 patients die just because they don't get the emergency help in golden hour. As I said, heart attack is first cause, which is 19% death in India. Then brain hemorrhage or stroke or paralysis attack, what we call, is the 4th leading cause of the death. Suicide, which is the 8th leading cause of the death. And you'll be very surprised, the age group is, all of this is very young age, between the 14 to 42. And then accident. By this time, we'll be talking for 5 minutes for this video. Almost 20 patients would have been died and 60 patients would have been critically injured. Golden hour is an hour from the onset of the disease or symptom. Within an hour, one patient should reach to the right medical care. And every day, many victims are transferred by ambulance. And if this ambulance reaches in golden hour, you can see the miracle of saving 24,000 patients per day. And reminding you, they are all young patients and 80% male, which is India is still a country where male dominant country, where importance of male is still there. We cannot deny it, however we want to talk about differently. See what is current scenario. Ambulance is there. We all know should be giving the way, but few people are not giving, so even we don't attempt. Or many times we hear, see the impact what I am trying to say. This gentleman has lost some near and dear. Today it is his, tomorrow it can be our also. And if the same thing is happening, do we accept that? No. That time we are very upset. Why people did not give? What's the problem? But this is what is happening every day. Every day we in hospital we sit the step of a patient and doctor would have thoda jaldi leke aate the to. And see, this young mother has lost her son. Tomorrow it can be we also, remember that. Fire brigade vehicle, which is needed for the fire rescue during the building collapse. See, the siren of ambulance and fire brigade is important. And many times we see that we don't want to give because it's an empty ambulance. But do you know, friends, when they go to pick up the patient, it is empty. So they do need to reach on time to pick up the patient also. And when they are taking the patient to the hospital, it is also important. And when they have to go back to their own position, or if they are going to fill up the petrol, they cannot say, okay, jara wait karna yaar, petrol bhara ke aata hu, fir bimar padna. Can they say that way? No. Emergency is emergency. So we need to be prepared and giving the way. They are 24/7 need to be ready. The delay can be more important. So what you can do, I'm just by mistake moved the slide faster. 4 simple steps. What? Calm down when you see the ambulance or fire brigade. Move left and drive slow. Everybody will move left and driving slow. Surely it makes a space for an emergency vehicle. And you can volunteer to be a traffic warden at that moment and help other vehicle to move the left, so ambulance goes to the right. You can call 100 number police Radhi Foundation has taken the initiative to enroll the police. Moment you give the information to 100 number, they will ensure that they coordinate with the traffic cop and cop makes a green zone for the ambulance. You can enroll your friends. Please do that. It will help us during our emergency. Today's preparedness for others is preparedness for tomorrow. Do charity. We do lots of charity, but making a way for ambulance and saving a life is one type of a good charity, I am sure. Please do enroll with us and spread the word and help in saving the life. Thank you.